What I want to talk about is is the guided respiration mindfulness therapy that I've been working to develop as a clinical form of breathwork. Very focused. It's a manual based. It's got specific instructions that are given to the client, and you can see there the client, there's really no verbal interaction except for the therapist providing guidance. That's all that's required, and you can see me there. I'm watching the chest, I'm watching the breathing. It's a moment-to-moment intervention. What is happening with this breathing? I'm keeping an eye on it. I'm providing suggestions. So that gives you an idea. So it's got three core components. It's got this respiratory regulation, which is the focus on breathing, focus on control of the breathing. It's got the mindfulness, which has a somatic focus. It's not about watching what is going on in the mind. It's not about engaging with thinking. And it has the relaxation, which is avoiding or noticing tension and not seeming let it go, and not responding to sort of impulses to move around. Okay, so one of the aims is one of the kind of assumptions in this approach is that our breathing can be inhibited, and there's a number of factors which can cause it to be inhibited. And the approach is aiming to produce an uninhibited, free, spontaneous breathing pattern. It is also aiming to deepen contact with somatic experience. That's a very powerful part of the process. Increasing awareness on sensations, and the mindfulness is particularly focused on sensations. What's the main sensation or the dominant sensation you're experiencing right now in your body? And it's asking the client to find that and just to focus on that until some other sensation replaces it as the dominant experience. Okay. And then its aim is to integrate the mind and the body, have them two come together so there's a lack of conflict there. Okay. So what inhibits breathing? So some of the research that out there is that basically you could say that the environment, we have a natural response to stresses in the environment that can cause our breathing to become inhibited. So social factors, being in socially significant environments, can elicit sustained inhibition. And I think that's an important word there, is sustained. This is about inhibited breathing becoming a habitual pattern. So we're not even aware of it. I ask people, do you think your breathing is free, or, is it, spontaneous, or does it feel inhibited? Most people would have no idea, unless it's an anxiety related experience they're having. And then they would say, yes, my breathing is terrible. So socially significant environments, you can imagine, you've got a partner, you get into some disagreement, do you want to go here for dinner or here for the dinner? The last time you went to that place, you thought the food was terrible, but they loved it, and you're having a fight about it. That interaction is going to cause an inhibition of breathing. It's a conflict happening, and breathing is going to become inhibited. We go into an environment where you're doing a presentation, for example, breathing will become inhibited. The environmental vigilance, watching the environment, high attentional demands. Here I'm living in Taiwan, and Taiwan is one of those countries which has a very high death toll from traffic accidents. And every time I go out the door here, I am driving along and I'm going to be assaulted from all sides, potentially. I never know when it's going to come, from a grandmother on an old scooter, from somebody on a push bike with vegetables on the back, other scooters, other cars. They're just going to be coming from all directions, and on the wrong side of the road. It's craziness. So I'm constantly vigilant, and the research says that these high attentional demands cause us to have inhibited breathing, which can become a habitual pattern. And I personally experience that. I can feel that. But the study is looking at people playing, gamers, online gamers, finding that they're just not breathing much at all, and their breathing is becoming inhibited with this high attentional demands. You can just think about working in an office, sitting at your computer, you're watching. You have to think, well, am I breathing or not? And possibly breathing is becoming inhibited. Expectation and anxiety, the perception of the environment as highly stressful. has been shown to be associated with inhibited breathing. So there's a lot of environments which are highly stressful. We can think about work environments, sometimes relationship environments, the COVID environment. We've now got a bit of a lockdown happening here, and it's a stressful environment. So all these things are, inhibited breathing is happening. It's a fact. We need to, and it's causing problems. So this bottom here, the conditioned inhibition of breathing is associated with high levels of CO2 in the blood, which has been associated with worry, negative affect, and traits of depression. So, we are kind of running away, in a sense, from the stresses in the environment by inhibiting our breathing, but inhibiting our breathing itself causes us to experience negative effects. So is there a feedback loop here? If emotions and physical sensations are feared or associated with loss of control, any trigger that evokes feelings can become threatening, and that's including breathing. If breathing is inhibited and breathing freely induces or elicits feelings which are uncomfortable, breathing itself can become an aversive experience where you can avoid breathing. And I have had plenty of clients in my practice with the breath work, with the GRMT, where that is exactly what they express. They don't want to breathe. They express that breathing is a scary thing. It's uncomfortable. They don't want to breathe. They don't want to feel the feelings. So I think this statement here, an inhibited breathing pattern may be a generalized breathing habit conditioned to the assessment that the world is a difficult and dangerous place. So that could be the case. So for the guided respiration mindfulness model, this is sort of like what proposing that a situation is encountered. And you have to think this is sort of pointing the direction to an evaluation for its efficacy in depression and anxiety. A situation is encountered which we have difficulty adapting to. Our somatic response, the sensations we have in our body to the situation is experienced as uncomfortable, and we just want to run away. This is exactly what people like Thich Nhat Hanh and Buddhist kind of scholars talk about. We are running away from the experience of the body as a sort of receptor of related to the environment. So inhibition of breathing helps to distance us from the discomfort, and this is entirely out of awareness. We are not deliberately inhibiting our breathing. No, it's a defensive strategy in response to aversive somatic stimuli. And the problem with it, if we want to keep that stimulus at a distance, that physical experience at a distance, we have to maintain the inhibition. So respiratory inhibition becomes a conditioned habit. Integration of experience is compromised. And that word integration, that's one of my favorite words. That is a really important word in mental health. I believe that it's integration of experiences that is the problem. We have difficulty integrating the experiences that we have. It leads to with a lack of integration of experience, we've got reduced vitality. The idea of the defense reduces our cognitive, emotional, behavioral flexibility, and we're no longer able to adapt. If we're not well integrated, if conflicts are sort of kept present, if we're unable to approach certain topics, certain things, then we are just compromised. And that's what I see in clients, continuously. I had a client recently who we did some GRMT with, and she actually has come from California and had a 10-year job in Silicon Valley, which was very, very stressful. And she came for a session, and what it turned out, what was really salient in the session was nothing to do with the job, because she was still stressful from that job, she thought, tearful, but actually what came out of it was what she had an insight in that breathwork session while breathing, that actually it was her relationship to her mother, an overbearing mother who was always demanding and never able to sort of give approval or acceptance, that was the real problem. And that was an unintegrated, parental experience that was still present and had been carried into other experiences like her job and a relationship with that and life in general. So that's this idea of integration. That was a somatically felt experience that had never been fully integrated. So the result of this inhibition is this increased vulnerability to things like depression, anxiety, stress, for example. A similar sort of idea comes from the experiential avoidance literature, which is related to ACT therapy, acceptance commitment therapy. There's quite a lot of literature. In fact, I only just sort of started to have a little look at the literature. I haven't looked at it for a few years now, and it seems to be continuing to grow. And the idea that we avoid experiences, we push them away, and this is related to things like anxiety and depression. And you can see that individuals reporting this greater experiential avoidance as pushing away the felt experience in their bodies leads to less positive emotional experiences, less life satisfaction and meaning, less frequent positive events on a day-to-day basis. So the message is, we are experiencing human beings. We are experiencing. That is sort of our function, is experiencing. We are sensing the environment all the time. If we push aspects of that out of our awareness, we're pushing not just a negative thing, a worry out of our awareness. We're pushing away our capacity to actually experience, joy, pleasure, the good things as well, and we are pushing away our adaptability. Okay, so move on. This is a picture of a session here we were doing recently at the hospital. This is not a study. I did a study with the Guided Respiration Mindfulness Therapy at this hospital, TzuChi Buddhist Hospital, which I'll talk about later. And after that, the nurses and doctors there, they were really quite interested to do more of it. And so this was a session which we organized. So this can be the GRMT can be done in a group, and it can be done individually in a private practice. It's really quite flexible. Different sort of considerations need to be in place. You can see me there. What I'm doing there is I'm walking around. After I give initial instructions to the whole group, what I do is I let them breathe, get them breathing for a few moments. I walk around and check what they're doing, and I give some individual instructions on helping people to engage with the breathing and stay present. And then you can see that we're having a chat afterwards just about what was that experience like. And I said that a session can take sort of 60 minutes for the breathing component. You can see there in that on the right there's a doctor there lying on the ground still, and she is sort of still kind of integrating the experience, and that was very interesting. She after the session, she's kind of finished there. She's just enjoying lying there. But after the session, she came and talked to me for a while, and she said that was such a profound. This was her first session, such a profound experience, that she knew that she had a really tight chest, frozen chest, she called it, and that she had great difficulty all her remembered life with breathing. And she felt there in that session, she just opened up. It just all opened up, and she felt things. She felt energy. She had an amazing experience. She tried to explain that to me, just how profound that was. It just changed her whole relationship to herself and her breathing just in one session. So it was really moving, her story. Anyway, okay. So there's the three components of the GRMT model. So in general, so the respiratory regulation, it's comparable to normal healthy breathing style. Or at least one conceptualization of that presented in the literature, and it includes this maintenance of a continuous rhythm. So there's no pauses, no between transitions. Okay, and so there is instructions specifically focus on that when the breathing is being guided, that you're going to connect your breathing, no pauses, no stopping, take another breath as soon as you breathe out, that sort of thing. Active inhale, so it's actively breathing. It's not just relaxing and resting. It's actually, you are going to work. It's breath work. And particularly in this style, it's about mobilizing the chest wall, intercostals, and the diaphragm, getting it actually moving. And so when facilitating in a session, if you were the facilitator, you would be looking for that. Is the chest moving? Is there some movement? And particularly getting it right up to here, moving the chest. And then a passive exhale. And this is a very specific thing. The idea is that on an exhale, there is no need to actually do anything. In fact, it's about learning to not do anything. It's learning to just completely let go. No control whatsoever. And that is a challenge for people. But then it very quickly, 1, 2, 3, 4, 5 sessions, depending on the individual and their level of inhibition that they've actually collected in their breathing, they learn just to let go. So what tends to happen over time is that breathing becomes breathing in and then letting go. And so that you're cutting down on the amount of energy consumed in breathing. You're just doing an in-breath, let go, in-breath, let go. And that's the style of breathing that is taught. So some of the literature shows that the characteristics of strained or inhibited breathing are this over-controlled exhale. So, this is you can think about, some of the yoga teaching, they say breathe into your belly, and what's a relaxed exhale, and demonstration of a nice, long, slow breath. That's okay, but it's not what this technique is after. It's after just to remove that control. Remove that control. It's about a sense of vulnerability, just letting go. So delayed onset of inhale, delayed transition to exhale, shortened duration of inhale, insufficient depth. These are all sort of indicators of a strained or inhibited breathing. So the next component in the model is mindfulness. And that's very much focused on somatically focused mindfulness. So it's concentration on the dominant sensation as it emerges moment to moment. So that is just identifying what stands out right now. Is it my ass on the seat being uncomfortable because I really need a pillow? Is that, it's the tingling of that, feeling of that? Is it the neck pain, from, bad posture for a few days, focusing on something? What is the dominant sensation, whatever it is? And as the session gets going and the breathing gets going and you get more tuned in, that will change and transform very quickly. And then it goes from a physical thing related to stress, current discomfort in the body, to more psychosomatic material that might be related to the to the sadness you have about grandmother dying a while ago, or the divorce that happened, or whatever it is, or just the stress in the office and the dysfunction going on there. So it becomes those sentient sensations that emerge shift as the process shifts. But the basic component there is just turning this attention towards somatic experience. So you can probably get an idea of what's happening here. You're breathing. It's a continuous rhythm. It's generating some energy, just enough so you can have a heightened awareness of your sensations in your body. And then you're focusing, you're doing that. It's continuous. The therapist or counselor is not letting you off the hook. You can't just stop and go to sleep. It's an ongoing thing. And you're gradually getting to master that. And then at the same time, you're focusing on the sensations in your body and whatever those things are happening. And you're doing it with this mindfulness, which includes this acceptance. So I'm not fighting anything. I'm just accepting what's going on. I'm just observing it. It's okay with me. If it's not, I watch that. I watch my struggle with it. I watch my frustration with it. I notice the feelings of that. So that's the second component. And then the third one is just a relaxation, and that's important. That's important to help promote the integration of all these feelings and sensations. We lie there, one position. We hardly ever do this. We don't move. We keep our hands. You saw in the picture, hands at the side. It's a very kind of open and vulnerable position. Often people will have a cover, a light cover, or whatever's needed to help a feeling of safety. But you're lying there and you're not fighting anything. You know, in a session, people will move, you know, they will move their hands, they'll lift their legs up, they'll want to turn on their side. It's like they want to do, you know, sometimes people want to do anything they can to move away from some little tiny sensation, that's niggling and it's uncomfortable. And so the idea here is with relaxation is that you just face it. It just helps you face that experience. What is this experience that's happening? What is this tingling that I want to run away from? And sometimes it's the tiniest tingling and it just feels so horrible, but it's not a big deal, but it feels a big deal. And so this is all about, you know, staying present in the experience that you're having right now. And by doing that and having their attitude, you know, back with this acceptance, just feeling it, not fighting it, it just quickly moves and gets integrated. So this breathwork model does invoke feelings. That's what it's partly about. It facilitates increased contact with the avoided or suppressed feelings, hidden psychological phenomena that come into view. You see the stuff that's suppressed after you get going. It's a very powerful modality. So you might feel fearfulness, lack of safety, you know, all sorts of stuff. Frustration is a real common one. People report feeling frustrated. You know, they feel frustrated and they think, I want to stop this. I want to get up. I feel so frustrated. You know, and if that happens, I'll say, well, is this a familiar feeling? And it's like, yeah, this is what I feel all the time. You know, in everything I'm doing. You can feel, but it also leads to amazing feelings of peace, joy, emptiness, just stillness, you know, and that's generally what the end of the session feels like. Somatic effects, you can feel tingling, heaviness. Some people will feel their body is moving off to the side. There's all sorts of sort of somatic experiences people can report. And this bottom one here, you may experience a somatic kind of working through process related to past experiences. And to give you an idea, you know, an example of that, I had a client who she was probably in her 50s, and she had, when she was sort of like 5 or 6 years old, she had an experience where her best friend who lived next door, they moved away without any explanation for her. She didn't know this was happening. All of a sudden, the best friend next door's gone. That caused her to have, you know, unbeknown to her, that was a trauma event for her. She lost a friend and she lost trust in other female friends. And so from that point on, she had adopted an idea that she can't get too close to female friends. You know? And she had never thought about that dynamic until in this GRMT session, where she went back to that point in time, remembered that incident, and it was like a domino effect of like, oh, that happened, oh, and that led to that, and that made me choose this, and oh, and that happened, and no wonder I have difficulty with female friends trusting them. No, so that's the sort of working through process that can take place. So this is quite a dynamic sort of a thing. So the general aims of it, you know, it's to create sustained contact with the physical experience in the body. What do we experience in our bodies? And then to help reintegrate that, that experience. Okay, so these are some of the papers, 3 of the main papers. These are my PhD papers. The first one there, breathwork, an additional treatment option for depression and anxiety. That was sort of setting up a theoretical rationale for breathwork, a clinical model of breathwork. It looked at things like, you know, what it asks, is there evidence out there that suggests that mechanisms in other existing treatments, you know, which are similar, you know, have some effect on anxiety and depression. And so they looked at mindfulness and looked at respiratory regulation, serotonin synthesis, things like that, and comes to the conclusion that yes, there's a good case for a clinical model of breathwork. After that, what we did was we taught a whole lot of therapists. We had 62 therapists. We enrolled through the Queensland Mental Health or Health kind of network, a bunch of psychologists and counsellors and a few social workers, a few nurses, and we trained them up in it, and we tested the training. we evaluated the training, we looked at it for treatment integrity and, a training model. And the conclusion of that was that, yes, people can learn to do this relatively easily with a relatively brief training process. And they can then provide the intervention to clients in a clinical controlled, in a clinical trial with a good level of treatment integrity. In other words, they can follow the manual and they do a pretty good job of it. And then that was the last paper here was that trial where we had 42 participants who had a DSM diagnosis of anxiety or depression as a major disorder, and enrolled into the study, and they received up to 10 sessions of the Guided Respiration Mindfulness Therapy. So this here is, I won't show you, there's not too much here. You can read the paper for more of this. This is the change in the DAS score. The DAS is the Depression Anxiety Stress Scale. It's quite well used. And you can see, so this is the sessions, number of sessions down here. The analysis used as multi-level modeling. So all participants, even when we had a few dropouts, were included in the analysis. And this is what their overall DAS score, depression, anxiety, and stress together looked like over that period of time. So, this is a moderate level of distress. We had some pretty highly distressed people in the study. We had 2 people with a personality, borderline personality disorder. We had a whole, there was post-traumatic stress. There were some serious cases, but the general, they all, improved. So that's what it looked like. That's the drop in overall distress. And then you can see the drop there in stress, anxiety, and depression. And the effect sizes were pretty good. So this is a pre-post, and they're very large effect sizes, which is good because it sort of like says, okay, the therapeutic alliance, which is, a known predictor of outcomes, is kind of like contained in there. So it's going beyond just that effect. In fact, we measured therapeutic alliance to see what sort of impact that was having on change, and it wasn't associated except for agreement on goals. The clients agreed with the approach taken. So so that's it's showing that it's a very positive result for a breathwork intervention. This was the anxiety sensitivity index, which is measuring people's sensitivity to anxiety. So it's the same people. And again, that's a significant drop. People became less sensitive to anxiety, which is kind of like linked in a way with Taylor's kind of response to pain, it's a similar sort of thing, really. Okay, so this is it's all very well to show the quantitative data. We did this, they filled in some measures, and have a look at the paper, because there's a bunch of other things we looked at as well. Life satisfaction, that increased, mindfulness, that increased. Anyway, so at the end of the session, the therapists who were assigned to the client, they conducted an interview, a semi-structured interview, and these were the questions here we asked them. If anything has changed, what do you, as a result of receiving the intervention, what have you noticed? What do you think is the most significant thing? What do you think that it contributes most to it? So we wanted to get an idea of just what they thought. We also had some extra things. Would you recommend it to others? And a good proportion said, oh, I already have. Would you do it again? And yes, they would. So we asked people, what did they think? What was going on there? And we did a thematic analysis of that, of those transcripts of those interviews. So it fell into 5 themes. People reported symptom reduction. This is what happened to my symptoms. Everybody reported relaxation. One person didn't report symptom reduction, but they reported other things. Right, relaxation, everybody reported a relaxation effect. Mindfulness, we had 91% of them reported mindfulness directly. And interestingly, these last two, confidence or motivation and insight related, they were kind of like the unexpected sort of outcomes or themes. A couple of participants' thoughts. My feelings have changed. I feel happier, calmer. I don't feel angry all the time. I came here with a problem. I feel like I've overcome that stage. I've now moved on. When I first came in, all I wanted to do was cry. So this is, this person had a life-changing effect. They thought at the end, I've grown as a person in lots of different ways since then. It went beyond symptom reduction. The second one here, a big change is I'm a lot more aware of my emotions now. I always knew that. I knew that I bottled them up, and this person thought they were going to go crazy, and they don't fear that anymore. And this one, interesting. I've never been so alone in myself, not alone like lonely, but just being aware of everything in my body. And they thought, wow, this is an incredible outcome, being in contact with themselves. This is just some charts from the nurses we had. We did the DAS with them, depression, anxiety, and you can see that the GRMT group, the solid line, that's overall distress score. And that's just gone down a lot. 5 sessions they had. This was mindfulness, 5 sessions, mindfulness increased. And this one here was self-compassion, which is interesting, an interesting kind of construct as well. And that increased. So there's a story in that as well. But that's basically it, I think, yeah. I think it's good evidence that a breathwork intervention can be effective with anxiety and depression. And I think it's well worth, with the current interest in breathwork and even, other kind of things like psychedelics, it's well worth giving it a go. And if in private practice, it's just a lovely intervention. People love it. They recommend it. They want to continue to do it, even as a maintenance thing over time. And it's a real honor to actually facilitate a session with